Hi, everybody. Welcome to the Les Turner ALS Foundation's January ALS Learning Series. Sorry, I'm laughing. There was just a little bit of a technical difficulty here. Before we begin our webinar today, I just want to remind you all that you are muted and off camera. And you'll stay that way for the entire presentation. So just sit back, relax, and enjoy the presentation. It should take about an hour. If you need to run or you know somebody who signed up but wasn't able to make it, it is being recorded. And that should be up on our website within the next couple days or so. And there will be a question and answer session after the presentation. So you will notice to the right of your screen, there's a little kind of toolbar. You can drop your questions into the questions section. So let's get started. I'm Anne-Marie Doyle. I'm the Community Education Manager at the Les Turner ALS Foundation. And before I introduce Laynie formally, I want to tell you a little bit about our foundation. First and foremost, the ALS Learning Series is made possible because of the Gilbert and Jacqueline Fern Foundation and our industry partners, Biogen and Mitsubishi Tanabe Pharma America. So who are we? At the Les Turner ALS Foundation, we are leaders in comprehensive personalized ALS care and research, and we realize that people living with ALS may feel overwhelmed and unsure of what questions to ask or what to do next. And that's really where our support services team shines. Our team is comprised of knowledgeable nurses, licensed therapists, and social workers who have many years of experience guiding people and their families affected by ALS. We offer a variety of services, including care visits by ALS support coordinators, need-based grants, and connecting people to community resources. At the Lois and Solia ALS Clinic at the Les Turner ALS Center at Northwestern Medicine, we offer access to enrollment in clinical trials and a multidisciplinary team to provide comprehensive support. If you're interested in more information on symptoms and care options or interested in browsing past learning sessions, you can find that all on our website at lesturners.org. Now, we know making decisions, again, about ALS care can be overwhelming, but we're here to help. The Les Turner ALS Foundation developed My ALS Decision Tool to help you learn about your options. These are free to use, available on our website at lesturners.org. Right now, we have modules on non-invasive ventilation, feeding tube, and genetic testing. Personal plug, hopefully sometime in the spring, we'll be launching a new module on people at risk of developing ALS who may have a family history. We are in our final stages of that module. If you fit that bill where you might be at risk of ALS or your family has a known history of ALS and you're interested in trying out the tool or want to provide us feedback, be a part of user testing, we have limited spots available, but please feel free to email me. I will drop that information in the chat with my email address. All right, so now the really fun part. I am so excited to be able to introduce you to Laynie Dratch, a wonderful genetic counselor who I've gotten to know well over the last year or so. Laynie is a board certified genetic counselor for the Penn Frontotemporal Degeneration Center and Penn ALS Center at the Department of Neurology at the University of Pennsylvania. She's co-founder and chair of the ALS FTD Working Group within the National Society of Genetic Counselors Neurogenics Group, as well as the co-founder of the annual Penn Familial FTD ALS Conference. Her research interests include the lived experience of individuals at risk of developing ALS FTD spectrum disorders and genetic counseling access and service delivery. Laynie completed her master's in genetic counseling at Johns Hopkins University / the National Institute of Health Genetic Counseling Training Program and completed her undergraduate studies at Colgate University, where she graduated summa cum laude with a BA in neuroscience and a minor in psychology. Welcome, Laynie. I am now going to make you the presenter so you can share your screen.
Wonderful. Thank you. Can you hear me and see my screen now?
Yes, everything looks great.
Okay, amazing. And I'm guessing if there's things that come up in the chat at the end, you'll help me with what comes in, right?
Absolutely.
Okay, wonderful. Well, thank you so much, Emery, for the really kind introduction and for inviting me to speak today as part of the ALS Learning Series. And so I hope that this is helpful information for you all. I have taken some questions that were submitted to the chat to incorporate a time of registration to incorporate into the presentation. So hopefully some of your questions will be answered by what I present, but I do hope that you will put any questions that come up as I'm speaking into the chat so we can discuss them at the end of the presentation. So I am going to just get started. Let's see if I can advance the screen. Okay, just some quick disclosures is that I have consulted for several different pharma groups. So I'm going to start by talking a little bit about the genetics of ALS. I'll talk to you about what the different types of genetic testing are, which I broadly categorize as diagnostic and predictive, and we'll get into what that means. And we'll talk about what are some of the logistics that are involved with genetic counseling and testing, and some other frequently asked questions that come up. I'll also provide you with some resources, and I hope that we can spend some time doing a Q&A. Before we jump into the information, I just like to make sure everyone's on the same page with what terms I might be using mean. And so ALS, of course, is what you're all familiar with as part of this ALS learning series. But FTD might not be familiar with. This stands for frontotemporal dementia or frontotemporal degeneration, and I'll talk a bit more about what that is. If you see AD, that means Alzheimer's disease, and PD refers to Parkinson's disease. So the big question that many people start off asking and along this sort of genetics journey is, well, is ALS genetic? So most often the answer is it's not often due to a single genetic cause. So most of the time it's not one single genetic difference that's causing someone's ALS, but sometimes that can be the case. And we'll talk about what factors influence that as we go through the information today. But most of the time, ALS is what we consider multifactorial, meaning there's more than one factor that contributed to why somebody developed ALS. That can be small genetic risk factors, that can be environmental exposures, that can be lifestyle factors. And right now, researchers are trying to work very hard to figure out what those factors are because it's very hard to pinpoint what those factors may be for any one person in particular. Whether a person has ALS due to a genetic cause, like I said, the likelihood depends on certain characteristics, which we'll unpack. And the importance of an accurate diagnosis cannot be understated here because, as many of you likely know, ALS can be a really hard diagnosis to obtain because it's a diagnosis of rule out. You have to rule out a lot of other conditions to land on a diagnosis of ALS. There's no one magic test that says ALS is the answer. And so sometimes I just like to give a step back for a second and give a quick refresher on what the heck I mean when I say a gene, because most of the time people don't spend every day thinking about genes, which is what I do. And so you might have heard genes described as the sort of instruction manual of the body, right? We all have the DNA code that we're born with. It's made up of a bunch of letters that spell out a code that tells the body how to grow and function. And so the DNA tells the cells in the body what to do. And so if you have a typo or variant or mutation, all those things meaning the same thing in your genetic code, it can mess up the meaning of the sentence. Just like if you have a typo on a page, switching just one letter here from the hip and the leg changes it to the hip and the peg, which clearly is a very different message. And if you were telling your body to make that, you would wind up with what you weren't expecting. And so similarly with ALS and with other conditions, sometimes there can be a single genetic difference, sometimes as simple as a single letter being changed in your DNA code that leads to a difference in the body and can lead the body to develop a condition like ALS. And so many of you might have heard that, ALS isn't genetic or it's infrequently genetic. And we've started to learn a bit more about the genetics of ALS over time. And we're finding that actually more people have a genetic version of ALS than we used to realize. So the vast majority of people with ALS don't have a family history of ALS or related conditions, which I'll explain in a second. So that's about 90% of people with ALS are probably the first person in their family to ever develop ALS or something similar. So when you have the, those vast majority of people who don't have a known family history, that 90% of people with ALS, only a small portion of them actually have a genetic cause, only about 10%. But if you are part of that smaller percent of people with ALS that do have a known family history of somebody else with ALS in the family or a related condition, then we can actually find a genetic cause most of the time in these situations, 75% or higher. And so that's why family history is really important here, and we're going to unpack that in a few slides as well. I just want to take some time to talk about what I mean by related conditions. So some of you might have heard of FTD, or frontotemporal dementia, but I want to make sure that we understand why I'm bringing this up here, and then I'll tell you a bit more about what FTD is. So back, a decade ago or more now, it became clear to researchers working in this space that families that had ALS also seemed to have some people with FTD, and vice versa. And some people with ALS developed symptoms of FTD, and vice versa. And as more research was done, it became quite clear that there's actually an overlap between ALS and FTD, both in terms of the symptoms, and so the clinical presentation, as well as the genes that can cause them, and the underlying issues in the body, or what we call the pathology. And so there's now been this growing recognition that there's a spectrum of conditions for this ALS FTD spectrum disorder, as we call it, where some people can develop ALS and symptoms of FTD, or vice versa, or some people can have a genetic cause found that if they have ALS can cause increased risk for FTD, or vice versa. And so a bit more about frontotemporal dementia. This is a younger onset dementia that it doesn't look like Alzheimer's. When people think about Alzheimer's, they think about memory loss and sometimes confusion, sometimes agitation, and typically in older ages, like 65 or older. But with FTD, or frontotemporal dementia, this tends to start earlier in life, and it doesn't present with memory loss as the primary symptom, but instead it can present with drastic changes in behavior, personality, language, movement, and executive functioning. And so this can look like people acting in a way that they wouldn't normally have, and perhaps in a socially inappropriate way. So having bizarre interactions with strangers, or making poor decisions, or even getting in trouble with the law when normally, their actions and behaviors wouldn't lead them down that path, or not being able to find the right words they want to use or put sentences together in a meaningful way. And from a motor perspective, as I told you, there can be overlap with ALS, but there can also be symptoms that are similar to Parkinson's disease. And so FTD is not the same thing as Alzheimer's, and FTD has been found to have strong overlap with ALS for all the reasons I told you before. And so here's just a visual representation for those of you who are visual learners like me, where, again, we have this broad spectrum of what frontotemporal degeneration is, with these different flavors or variants, the behavioral types, the language types, the movement types, and there's overlap among these conditions with ALS, as well as symptoms can look like Alzheimer's, even though, they are quite distinct in some people. And so I started to mention before that the likelihood of finding a genetic cause depends on whether there's family history of anybody else with ALS or other conditions like FTD. And that's because, having this stronger family history of more people with ALS and FTD increases the likelihood that we would find something if we did a genetic test. The family history is a great starting point to figure out what's the likelihood of us being able to find a genetic cause, but it's not a whole picture because of a lot of different reasons, namely that not everybody with a genetic difference always goes on to develop disease in some cases. And so there could be a genetic variant being passed down in the family for generations, and other people may not have developed symptoms. So that's the concept of penetrance. How likely is it that symptoms will develop if I actually have that genetic difference? And so that's one pitfall of family history, and I thought I'd just talk to you about some others. So sometimes people don't get the right diagnosis. As I was saying, ALS can be really hard to get a diagnosis for, and FTD is the same way. So people might get misdiagnosed with something like MS or Alzheimer's or whatever it may be, or people might not make it to the doctor at all and be a missed diagnosis where they never sought care. Sometimes, even if there is a condition running through the family, people might not be sharing that information with each other. Sometimes, families all have different dynamics. We've all got drama in families. It comes in every family. I've taken so many family histories. We can't hide it. We all have it. And so sometimes people don't communicate. And also sometimes people can feel embarrassed or like they don't want to share their diagnosis, even if they do have good relationships. And sometimes people don't know their biological family. They might be adopted, or they might have been displaced. Some families are affected by things like war or historical events that led to dispersion. Sometimes people come from a pretty tiny family, and so it's hard to say, what's the likelihood this could be genetic, because we don't have anyone really in the family tree to look at. There weren't a lot of other people who could have gone on to develop symptoms. And sometimes people die young from other causes, right? Like people can have heart attacks or cancer or whatever else may be, contributing to death in the family. And maybe had they lived long enough, they could have developed symptoms, but we don't know because they didn't live long enough. And sometimes it can be hard to recognize that there could be a genetic cause in the family because maybe nobody else in the family had ALS. And so you didn't think that, there was familial ALS. But when you start looking through the family more closely, maybe there were some people with some odd behaviors all of a sudden later in life, or maybe there were some people with, Parkinsonism and dementia that never got a clear-cut diagnosis, and maybe those could have been related to the ALS. So a genetic counselor can take a detailed family history and use that to help you better understand what's the likelihood that this could be genetic, and then help you decide whether testing is something you want to pursue. And so, I talked a little bit about what genes are, and I just wanted to share that it's not just one gene that causes ALS, right? There's actually over 30 genes that have now been implicated in this ALS FTD spectrum of disorders, and more are likely to be discovered over time. And there's a lot of work going on in the field to try to better characterize some of these genes and some of the variants within them, so we can get people more information once they get this diagnosis. And so if a genetic cause is found in the family, many times people then want to know, well, what does this mean for my kids or for my siblings or for others in the family? And so this is when the inheritance pattern comes into play. So most of the genetic forms of ALS are inherited in what's called an autosomal dominant inheritance pattern, where if a person has one copy of the gene that's not working the way it's supposed to, that's enough to cause symptoms. And we all have two copies of almost every gene. So if you look at the diagram here, you see a father has the condition, one copy of his gene isn't working, that's why the X is there. And so then each time that he had a child, he had a 50%, so a 1 in 2 chance of passing down that non-working copy of the gene to his child. And so in an autosomal dominant inheritance pattern, there's a 50% chance for each child to inherit the same genetic risk. What I said before still applies here, though. Some genetic differences have a very high likelihood of symptoms developing if you inherit them, whereas others only slightly increase the risk. This is that idea of penetrance again. And a genetic counselor can help you understand, based on the genetic cause identified in your family, what the risk would be to family members and what the penetrance tends to be of that variant. And so most of the genetic forms of ALS are inherited in that pattern, but there are some exceptions. But as I talked about from the beginning, it's only a subset of people with ALS that have an autosomal dominant genetic form of ALS. The vast majority of people do end up falling into this idea of multifactorial inheritance. So if you can just imagine for a second that we all have this jar, as you can see on the screen, and if you fill up the jar to the brim and it overflows, then that means ALS is going to develop. And so we're all born with different risk factors for developing ALS. There can be teeny tiny genetic vulnerability factors like those little yellow balls in the jar. And some people might be born with some big genetic risk factors like the bigger yellow ball. And then there's other things we're exposed to in our lifetime, like environmental exposures, lifestyle habits, things like this that are, depicted in blue. And so if you have enough combination of, these blue and yellow balls in the jar to tip it over, that's when ALS develops. And there's also protective factors that might be to increase the size of your jar. So maybe there's things that were good about your diet or about your exercise, or maybe you have genetic protective factors. And so most people fall into this category where we can't pinpoint, well, what are those yellow balls? What are those blue balls that are causing increased risk? But we know that that's more likely to be the case than one single genetic factor that's filling up that whole jar. So sometimes people will ask, what does all this matter? What's the difference between apparently sporadic versus familial versus genetic? What does all this mean? So if any of you have met me before, you might know that I personally hate the term sporadic because I think it's misleading. Sometimes people say sporadic when they mean that only one person in the family has developed ALS. And sometimes people use the word sporadic when they're trying to say it's not genetic, as in there hasn't been a genetic cause identified. But it's hard because you can really only have this be apparently sporadic because there might only be one person in the family with ALS, but what if they're the first person to develop it? What if somebody else develops it in the future? And maybe there isn't a known genetic cause now, but what if in the future new genes are identified that can cause ALS, and that was really the cause? So personally, I don't really like the term sporadic, and it honestly doesn't change much. Really what people want to know is there an identifiable genetic cause that has implications for me and for my family? And so the symptoms that people experience can't really help us figure out, could this be genetic or not, because they have overlapping symptoms. There's no one symptom that tells me, oh, that's going to be genetic. Sometimes people ask if having an autopsy can help figure out if there's a genetic cause. Sometimes there are findings on autopsy that might make us suspicious there could be a genetic form, like certain proteins building up in the brain or spinal cord, but many of the autopsy findings can be seen with or without a genetic cause present. And sometimes genetic testing can be completed on autopsy, but it's not always included or returned to people. So, that's not always a deciding factor here. And we've been talking a lot about how family history plays a role here, but as I mentioned, it's a limited tool. Family history can guide us, but you truly just can't know if something has a genetic cause unless you try to do genetic testing to understand more. So how can I find out if the ALS in me or my family is genetic? Why don't we spend some time talking about genetic counseling and testing, which I think will answer many of the questions that were submitted. So genetic counseling is really a process. It's where the genetic counselor and the patient or client partner to make sure that the patient and their family is getting the right information they need and resources they need, and helping them to make decisions that are best for them. And so typically a genetic counseling session will involve review of family history, as I mentioned before, an explanation of the condition and the genetics of that condition, and exploring how that is affecting the person and their family. And so we'll use the family history to figure out what's the likelihood of a genetic cause being found, to help figure out the most appropriate testing, to help figure out, who else in the family might be at risk, and, those sorts of things. And as I said, talk about the condition, about the genetics, about resources, and then help you make the decision that's best for you. That's really our purpose. The genetic counselor is not there to tell you what to do, but rather to give you the information and support you along the way so that we can best support you in the decisions you want to make. And so I should say before I move on here, even though I'm going to focus now for this next section on genetic testing, I want to emphasize that genetic counseling is not the same as genetic testing. Anybody can meet with a genetic counselor and choose not to proceed with any testing. Just seeing the counselor does not mean you have to do any testing, and there's other reasons why people find value in having a genetic counseling appointment, even if they know they don't want to test or if they've had testing in the past. And so I'm going to talk a little bit about the two main types of genetic testing that are out there. The first is called diagnostic. And this type of testing is when we test a person who's got a condition, so in this case ALS, and determine whether we can find a genetic cause that explains why they've developed that condition. And so the importance of this for people diagnosed with ALS has recently been recognized even more strongly. And my colleague, another genetic counselor, Jennifer Rokenbach, just this past year published evidence-based guidelines, sort of asserting that all people with ALS should be offered genetic counseling and testing, because now there are the potential for treatment impacts if we find a specific genetic cause. And so in addition to the potential to treat, there's other benefits that I'll talk through, but we now feel it's really important that everybody with ALS be offered the opportunity to undergo genetic counseling and testing if they want. And so as part of the guidelines, we laid out, what genes should be covered and what are some important counseling elements to consider. And I just put this here for your reference. But this is really more important for your clinicians to know about. One of the things I'll mention is we said that all people with ALS should have access to counseling and testing, but there's diversity in ALS genetics in terms of what genes might be impacted if you're from different parts of the world, and also how easy or difficult it might be to access genetic counseling. And I'll come back to that. But, sometimes people talk about the genes that are most common in ALS. You might have heard C9orf72, the repeat expansion that occurs in that gene, SOD1, tardy BP and FUS. Those are the ones that tend to be most common in North America, with C9orf72 being the most common. But as you go around the world, there's more variability. And as I mentioned, there's this potential to treat, and that's one of the things that's really exciting and really driving the fact that we now feel that all people with ALS should have access to counseling and testing. And so as I'm sure many of you have heard, in 2023, the FDA approved the first gene-targeted therapy for ALS called tofersen or Qalsody. And this is for people with ALS due to a specific gene called SOD1. Now, people with variants in this gene, it's quite rare. Only about 2% of ALS is explained by variants in this gene. But when people do have variants in this gene, it tends to be a more early onset, more rapidly progressive type of ALS. For the most part, there are some variants that are different, that tends to have a profound effect in the family with many, many people diagnosed over time. And so even though this is only a technology that's available for a small percentage of people right now, we're hoping to learn a lot from it and be able to apply it, this technology and these learnings to create medications for other forms of ALS. And I have to give a shout out to Dr. Colin Quinn, who is one of the neurologists I work with here at Penn, who, in the top right corner, you can see there, was dosing one of the first patients with tofersen once the drug was approved, which was really exciting. So that's been a very exciting time in the ALS space, and hopefully it continues. But beyond treatment, there are other reasons why genetic diagnosis can be helpful. So for some people, like I said, getting a diagnosis of ALS can be really difficult. And if we find a genetic difference that, is in a gene related to ALS, that can give more evidence to the diagnosis and help end a diagnostic odyssey. And that in itself can be a relief to just have an answer and also to know why. Many people, when they're diagnosed with ALS, they want to know, why did this happen to me? And so if we can tell you were born with a genetic difference that put you at high risk, for some people, that alone is a motivation to try to do the testing. Some people find it helpful that we can maybe give you more information about what to expect for the future if we get a genetic diagnosis, like is that genetic difference that was found in you also associated with risk for FTD or risk for Parkinson's or anything else. Sometimes people feel like this is good to access research. Is there a clinical trial targeted to this gene, or is there an observational study where I can contribute and help the science, where they can watch and learn from me over time? Are there more specific support resources we can connect you with? And importantly, beyond what it can do for the patient is what it can do for the family too. So there's benefits to the patient that we just talked about, and then for the family, it can tell us what's the risk to your kids and siblings and extended family, and then they can decide whether they want to do anything with that information, which we'll get to in just a minute. And so when we do genetic testing in ALS, what tests are offered might vary a little bit from center to center, but as you saw with the guidelines I showed you, there's now starting to be a push towards standardizing that a bit more to make sure it's at least comprehensive. And so some of the genes and tests that we tend to order are on the screen here for your reference, but your clinician would guide you on what's best for you. One thing I'll mention is that if you listen to previous talks, you may hear genetic counselors talking about the option to do DNA banking, where you save a sample of a person's DNA by sending blood or saliva to a laboratory and don't actually do any testing on it now, but you then save it for the future in case the loved one passes away, and in the future you want to have access to their sample. Right now, the main service that was offering that is unfortunately closed, and we're looking for alternative solutions. But if that's something that you have interest in, talk to a genetic counselor and see if there's anything locally that they might be able to help you, use for DNA banking. And so if a person with ALS undergoes genetic testing with those tests that I just had on the screen, this is, again, diagnostic testing to see if we can find a reason why symptoms have already developed. The results of testing can come back in three main ways. The first is positive, which would mean we found the reason for why ALS developed. And as I said, there's many potential benefits with that. It can help us anticipate the future, it can help with research access, and it can inform the family. If the results come back negative or normal, this means we didn't find the cause of the condition. It typically doesn't lead to any changes in management, and we can revisit it over time because new genes can be discovered, and some people may have more comprehensive testing completed than others, and we want to make sure all of the right genes were analyzed. If no cause is found in the person diagnosed, typically there's no testing we can recommend for family members if the testing of the person diagnosed was comprehensive. Because if we don't find the cause of the person with the symptoms, we don't really know what to go looking for in a person without them. And lastly, if the results are uncertain, that means we found a difference in a gene, or more than one gene, but we don't have enough proof to say whether that difference or the multiple differences could be actually causing a person's ALS, or could just be normal variation like we all have in our genes, and many of those variants don't cause any problems at all. And so because we're learning more and more about genetics in general, but especially in ALS, the chances of finding an uncertain finding are quite high because we see differences in genes, but we don't have enough data yet to say, could this be causing symptoms or not? And so typically we don't have any changes to management based on that. We keep an eye on it over time. There might be steps we can take to try to clarify whether the uncertain finding is the cause. Like if another person in the family has ALS, we might test them to see if they have the same genetic difference. But typically in this case, we wouldn't change anything with management. We would keep an eye over time, and we would not recommend family members get testing for something uncertain if they don't have symptoms, because we wouldn't know what it means for their risk. So sometimes people ask, a genetic cause of ALS was found for me as the person with ALS or my loved one with ALS. Do I have to tell my family? Should I tell my family? I'm scared how they're going to react, or I don't want to upset them. And this is completely understandable because it's a lot. It's a lot to have to communicate that to your family. But really what we as genetic counselors encourage people to do is share this information. And so it can start, the process can be made easier by being proactive from the start. So when you're considering having genetic testing, you might consider, before you even get your results back, reaching out to your siblings or kids and saying, as part of my care for ALS, I am thinking about having genetic testing done, or I am having genetic testing done. The results could have implications for you. Do you want to know the results? Or how do you want me to tell you the results? Or when do you want me to tell you the results? So you can start the conversation before results even come back if you're comfortable with that. And again, family dynamics differ. That might not always be easy to do, but that's one thing you can think about. Also, once you provide the information to people, they don't have to do anything with it if they don't want to, but they can't choose to use that information in any way unless they hear about it from you. And so a genetic counselor can often help with this by providing a family letter, so you can tell your family members and then give them some written information so that they know how to contact a genetic counselor. A genetic counselor might be able to offer a follow-up family visit where you come back for another visit and invite family members like kids or siblings to join. And this way they can get access to resources, and we can avoid some of the anger and resentment that we know has been demonstrated in the literature to happen if people withhold information. So many times I've had parents say, I don't want to tell my kids until they're 18 because we don't offer this type of testing until someone's 18 or older anyway, where they're learning to see their own risk. Or I'm not going to tell my kids until they're getting married, until they're having kids, because that's when they would use it. But as we're going to talk about in a second, there's a lot of reasons why sometimes at-risk individuals think about having testing beyond those things. And we've seen in the literature where people feel resentment when this sort of gets bomb dropped on them at a key moment in their life, as opposed to having an open, early, honest communication and sort of communication channel already open and established with the person who's got the result. The other thing is, again, I want to remind you about penetrance. Not every person with a genetic variant will go on to develop symptoms in many cases. And so even though it might feel like scary information to give to family members, they can't learn more about their risk and about the odds of developing symptoms unless they start by hearing it from you. And it might not be a guarantee that they would ever develop symptoms, even if they inherited the same genetic cause. So now we're going to switch gears a bit and talk about people at risk. And so we talked about diagnostic testing, which is when you test people who have ALS looking to see why. And now we're going to talk about predictive testing, which is when somebody in the family doesn't have any symptoms, but is trying to decide if they want to learn whether they've inherited this risk. And so this is something, again, that we only do for adults, people who are 18 or older, with very rare exceptions, because these are conditions that typically don't have onset until somebody is in adulthood, and there's no intervention or nothing different we would do about somebody's care right now prior to symptom onset in childhood. And so we think it's really important that people get to make their own decisions for themselves about whether or not they want this information. And that's why we wait until they're 18 or older, so that they can make their own decision for that. It's much, much, much more straightforward for somebody to undergo this predictive genetic testing if somebody with ALS in the family has already had genetic testing with a cause identified. Because then, instead of broadly testing for genes that we know can cause ALS like we do for the person diagnosed, we can test the person at risk just for the variant found in their family. And then instead of that positive, negative, uncertain type of result we can get in diagnostic testing, for predictive testing, when there's a known variant, we can test just for that variant and say yes or no. Did you inherit this or did you not? And so it's much more straightforward for a person at risk if there's already been a genetic cause identified in the family. And that's a big reason why some people with ALS, even without family history, think about genetic testing, even if it's unlikely to, be positive, if it's unlikely to be found. Sometimes family members really want this information to guide their next steps. And so just like testing a person with ALS is a personal choice, so is testing a person at risk. And it comes with even more added layers of emotional and legal concerns that I'll get into in a moment. But it's a big decision. Do you want to live knowing you've inherited risk for this condition, ALS, for which right now there's no cure? And so, it's a heavy decision, and we think it's really important that this type of decision is only made in the context of genetic counseling. Please don't go to your primary care doc and ask them to just order this test for you based on your family member's result. It's really important you meet with the genetic counselor and think about, all the information and all the emotional considerations before proceeding. And this should only be done in a lab that's trusted and approved to do this type of testing. Sometimes people who are at risk and considering having genetic testing will undergo other elements of visits when they're considering this type of testing, like meeting with a neurologist, for example, if they had concerns that they could have symptoms or they wanted a baseline exam. And sometimes they might also meet with a psychiatrist to make sure that they're in a good place with their mental health to be able to process potentially stressful news. It's not always required, but some institutions might include that as part of the process. So some people ask me, why do people think about this, right? Some people feel very strongly that they do not want to know their genetic risk status. If they found out there's genetic risk in the family, they say, I cannot know this information. I want to live my life. It would be very stressful, very emotional for me to live knowing I have this risk. And that is fine. Many people choose not to learn their status. But then there are also many people who feel this would be empowering for them for many reasons, whether it's just needing to know one way or another, did I inherit this or not? I got to get rid of this uncertainty. I got to just know. Some people feel that they want to use it for different planning, whether that's life planning, like what career they want or where they want to live or what their financial plans are, or they want to use it to make different decisions about their reproductive plans. Like, I want to use some of the technologies that exist to avoid passing down this genetic variant if I am going to have more kids, or maybe I don't want to have children, or those sorts of things. Some people already have kids and want to know the risk for them. And some people want to be able to join any clinical trial or observational research study that they might be eligible for. But even when people feel motivated to test for some of these reasons or others, it's important to weigh some of the other issues that can arise, like what the impact of learning this information could be on relationships with your family, like your siblings, for example, or significant others. If you don't have a significant other, how might that influence your willingness to date and when to disclose this information? And you have to, be able to decide, is this something I'm going to be able to handle from like an anxiety and stress perspective, regardless of how the result comes back? And for that reason, we always recommend people bring a support person if they're thinking about going through the predictive genetic testing process. But the big thing that I want to spend some time on is insurance and legal considerations, which I sort of teased for you a moment ago. Excuse me. So in the United States, there's a law out there called GINA, stands for the Genetic Information Non-Discrimination Act. And I bring this law up to point out its protections, but mainly also to point out its flaws and what loopholes there are. So this law says that generally your health insurance and your employer cannot ask for or use your genetic information against you. There are some notable exceptions, like people who work for the military or for small employers with less than 15 employees. But generally, your employer can't ask for this information and use it to not promote you or to fire you or not hire you. Your health insurance company can't ask for this to deny you coverage or charge you a higher premium. It's just illegal per GINA. But this does not apply to things like long-term care insurance, life insurance, and disability insurance. So those types of companies can ask for information about your health, including your genetics, and use that to make decisions about whether they'll cover you and what the premium would be that they'll charge you if they do. And so sometimes people can get these types of insurances through their employer where they don't have medical screening as part of it. It's just provided if you pay for it. But often when you apply for private life long-term care disability policy, they ask questions about your personal and family medical history, and they might request medical records. So it's really important to think about what insurances you have in place before you put any information in your medical chart and before you think about having genetic testing. There are some other laws, some that are state-based that have additional protections, but this is the main genetic discrimination law in the country. It is very rare that discrimination has been proven to have occurred, but it's still really important to consider because even if there are these protections in place, there's not protections in place against things like accidental disclosures. Like if you tell your coworker or your boss something and then they choose not to promote you or something like this, it'll be very hard to prove that they discriminated against you based on your genetic status. So it's really important to keep these types of privacy issues in mind when considering learning your genetic risk status. And this is why it's very important to meet with the genetic counselor before deciding if you want to have predictive testing. So to switch gears a bit, sometimes people just want to know, well, in general, what's my likelihood of developing ALS, right? So you've got a person who doesn't have any symptoms, they haven't undergone predictive testing yet, and they just want to know, what's my likelihood of developing ALS? Well, if there's only one person in the family who's ever developed ALS, most of the time, you're probably going to be considered at that baseline general population risk for ALS, which is roughly about 1 in 300. It's slightly higher in men than in women. That's in the absence of any genetic testing in your family and in the absence of a strong family history. But if ALS has been found in a relative and genetic testing hasn't been performed, the age of onset and the family history can give us some clues. But again, the genetic test is really the thing that helps tell us, what's the likelihood for another person in the family to develop symptoms. And as I mentioned before, there's other things that can contribute to ALS risk, like teeny tiny genetic risk factors we can't even test for yet, environmental exposures, lifestyle factors, and so forth. And so there are groups working on trying to establish guidelines to try to better understand and better advise people who might have risk for developing ALS based on their family history. What can you do about that to minimize risk factors and enhance protective ones? So here's an example from a submitted question. Are children of ALS patients more likely to get the disease, even if the patient doesn't have a genetic disposition? So this might seem like a simple question, but I'm going to give you a complicated answer. So it depends. So first thing I'd want to know is, did the person with ALS undergo comprehensive genetic testing? Because if a person had ALS genetic testing years ago, there might be genes that we've discovered since then that weren't included in the testing. So for example, I mentioned before that C9orf72 is the most common gene causing ALS in North America, at least, and that genetic discovery was only made back in 2011. So if anyone underwent genetic testing prior to that, they wouldn't have had genetic testing for the most common genetic cause of ALS. So that's one thing, is we need to know what testing they had. The second thing we need to know is, what was that person's family history like? If a patient with ALS had a strong family history of other people with ALS or related conditions, underwent testing and nothing was found, we would still consider other family members at higher risk based on their strong family history. We know that more genes are likely going to be discovered in the future, and so it's possible, even if we tested someone for all the genes we know about now, it still could be a genetic version of ALS, and we just don't know the gene yet. But if a person with ALS has no family history of ALS or other known related conditions, and they had comprehensive up-to-date genetic testing, then the likelihood of another family member developing ALS is quite low. Again, that baseline population risk is about 1 in 300, but we think it's based on the literature, there is at least one paper that suggests the risk to the next relative is slightly higher than that, maybe closer to 1% instead of that 0.3% that's 1 in 300. But it would still be a very, very, very reduced likelihood of a family member developing ALS if the only person in the family who had ALS had negative or normal comprehensive genetic testing. So what if my family doesn't have a known genetic cause? As I was just saying, not all genes have probably been identified. We're always making advances, and so it's really important to stay in touch with genetics. So even if you saw a genetic counselor years ago, you can always check in for updates, and you can always ask your neurologist for updates as well. It's so important to save copies of any genetic testing reports from testing that has been done in the family, so that we know what's been completed and what might be recommended. Sometimes if people had testing for the genes that we know right now can cause ALS, they might consider broader testing like an exome or a genome that looks at almost the whole DNA code. Those tests can sometimes be more expensive and harder to get insurance to cover, but then you can go back and look at the data over time, and as new genes are discovered, we have the whole DNA code spelled out, so we can go back and use that as a tool over time. And as I mentioned, DNA banking right now is a little bit of a tough thing to find. And like I said, you can always request to meet with a genetic counselor to go over the current information and to get information tailored to your specific family situation and your specific testing situation. Another common question is, if my parent had ALS and didn't have a known genetic cause, can I get tested? Should I get tested? Again, the likelihood of there being a genetic cause depends on all the factors we talked about. Technically, if no cause of ALS has been found in your family, but there's a family history that's suggestive, a person still could undergo genetic testing, or this predictive testing broadly for genes we know can cause ALS, but it's a lot more nuanced than if we just have that yes or no answer we're looking for based on a known cause in the family. Because if we get a negative result, we can't give you complete reassurance because we can't prove that we tested for the right thing because we don't know the cause of the family member's condition. And sometimes we can get those uncertain findings and we don't know what to do with them because we don't know if the person with ALS had them, and then we have no clue what to make of them. So technically, if your family had ALS and no testing was done and you want to know if you can have testing, technically the answer is yes, as long as you understand these limitations of what the results would mean. So I would encourage you to think about, like, why are you doing this, right? What are you trying to learn? What would this change for you? Just like anyone considering predictive testing, but really understanding that we can't quite rule out genetic risk. So what are you hoping to get out of this? And is this testing still valuable to you? So the answer to who should have a genetic counseling appointment is really anyone who wants one. It's really anyone who thinks they could benefit from information, even if they don't, want to have testing, or if they've already had testing. Anyone who is looking for information, for support, for resources is welcome to make a genetic counseling appointment. And again, having a genetic counseling appointment does not mean you have to have any genetic testing. As I sort of hinted at earlier, sometimes not everyone with ALS is going to be able to access a genetic counselor because there's not enough of us. And so there are ways that you can try to locate a genetic counselor. Like you can ask your neurologist for a referral. You can use the Find a Genetic Counselor tool that's online and linked here. There's also some telehealth companies that have genetic counseling where you can meet with a genetic counselor from the comfort of your home. And that way, even if the clinic you're going to for your ALS care doesn't have a genetic counselor, you might be able to access one remotely. And right now there are some sponsored no-cost genetic testing programs that are offering genetic counseling, but those would still need to be ordered by a provider like your neurologist. And in the meantime, if you can't get access to a genetic counselor, but you want to learn more, there's ways that you can get more information. So you're already doing that by attending this webinar today. And I'm going to do a shameless plug for the Penn Familial FTD ILS conference that'll be in February 21st, and I'll have a link to that in the resources. But also, another shameless plug, there were a few genetic counselors that helped to create this, in partnership with Les Turner, this wonderful decision tool where you can get information about ALS genetic counseling and testing and use that to then talk to your own provider, learn more about the genetics, decide whether testing is right for you, and then go to your provider with what you've learned and ask them to facilitate the process for you. But please, 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 please do not seek out predictive testing. So a person at risk looking to see if they've inherited the risk without seeing a genetic counselor, right? Your neurologist might be able to order the testing for you if they feel comfortable with it, if you have ALS, but please, if you don't have ALS and you're looking to see about risk, please see a genetic counselor first. So just a few things about logistics of how we actually do the counseling and testing. Here's some tips about how to prepare for a genetic counseling visit. The take-homes here are: bring any testing that people with ALS have had or related conditions like FTD or dementia. Bring any questions you have, and spend some time collecting what you can about your family history before you come in, because one of the first things the genetic counselor is going to ask you about is that family tree. One logistic question that people sometimes ask about is, how do I access this? One way is through clinical care, where just like any other medical care, you would meet with a provider, whether it's a genetic counselor or neurologist. You discuss the testing. If you wanted the testing ordered, they would order it for you. It's usually paid for by your insurance. And then the results would return back to your doctor or genetic counselor, and then they would return those results to you. Everything would have your true name and date of birth on it. It's kept in your medical chart. On the research side, it depends on the research study. But in this situation, the goals might be to advance science, and you may or may not get the option to learn results through genetic testing through a research study. So it's really important, if you're getting testing done through a research study, to ask when you join the study, will I get to learn my results? But the nice thing about research is that all of the cost goes to the research study, so you don't have to worry about that. And the results are kept in research records, not your medical chart. And so this can be sometimes a comfort for people considering predictive testing if they don't want information in their medical chart yet. What research options are available depend over time based on what studies are out there and what the funding is. But typically the testing can be done on either blood, cheek swab, also called buccal, or saliva, which is like a spit kit. The most common used form right now is the cheek swab, the buccal. How long it takes to get results back depends on what testing was ordered, but for the typical ALS genetic workup, it will take about a month to get results back. If you do broader testing like that exome or genome that look at pretty much the whole DNA code, it could take longer, like several months. In research, it depends on the protocol if you're even going to get results at all. And if you are getting results, sometimes it can be this same time frame, but sometimes it can be years. So it's very important to ask that. And again, the cost of testing can vary, but it's often either completely or very well covered by insurance. If not, the out-of-pocket cost can be about like $250 or less for most of the sort of basic ALS genetic testing. It can be much more for the broader tests. And so your genetic counselor can help you work through that. And like I mentioned, there sometimes are no-cost sponsored testing programs available that the genetic counselor can talk to you about. And in research, the costing is typically free. And so sometimes people wonder, you know, how genetics and research intersect. And so sometimes it can be good, you know, if a genetic cause is found in the family, it can help both the patients and the at-risk individuals get access to observational and or interventional clinical trials. And for the research community, it helps us better understand the conditions and the different genetic forms, which then can help inform therapeutic development, like how we've got the tofersen approval now. And so research options can sometimes help people feel like they're contributing or like they're making meaning of this experience. And it also can be a benefit to the community because we can learn more. And so I'm just going to leave you with a few thoughts, and that sometimes people are asking me, you know, I've already been through this process of getting the diagnosis of ALS, which in itself can be a nightmare. Why the heck do I want to start this new journey, right? For some people, getting a genetic diagnosis is a whole new journey, and it can bring positive and negative feelings. It can be an answer to why this is happening. It can feel like a relief and get a sense of understanding, but it can also be super stressful because you're concerned about the family, and it can feel unfair. Like why me? Why was I born with this? Or why does my family have to deal with this? Then it brings up the issues of how do I communicate this to the family, which we talked about. But then that can lead to feeling a sense of control and planning, like you're doing something. And so this whole thing is a journey. It's a roller coaster of emotions. There's no right or wrong way to react. And that's a big reason why there's also no right or wrong decision to whether to have genetic testing. It's completely up to you. And so in summary, before we get to the questions that might be in the chat, the majority of people who have ALS don't have a single pinpointable genetic reason for why. Variants in the genes I have listed here are some of the most common culprits and are associated with autosomal dominant inheritance, which we talked about before. You're more likely to find a genetic cause if there's family history of ALS or related conditions. Regardless of family history, genetic testing is available. It's always best to start with a person who's been diagnosed if possible, but then you know, family members at risk can consider whether testing is right for them, especially if a cause is found in the family. Please talk with someone with expertise in genetics before pursuing testing, especially if you're doing predictive testing. And know that speaking with a genetic counselor does not mean you have to move forward with testing. It is always going to be optional. So thank you. I know this is a lot of information. I hope this is a kickstart to answering some of the questions you might have had. I'm going to leave some resources up here while we chat in case you want to take a screenshot. All right, so I'm trying to see in the chat if any questions have come in.
Lainey, I'm not sure if you have like if you can see the questions. That might just be on my end for admin.
Yeah, I can't
Um,
see them.
but I think you covered a lot of them. There
Mhm.
was some questions about, and you touched on this a bit, on
Mhm.
maybe there was never suspected a family history, but now there's a new family member
Mhm.
recently diagnosed with ALS. And maybe the first person, it was years ago, they never even were offered genetic testing. The second person was offered genetic testing,
Mhm.
but the results came back negative. Should
Mhm.
other family members still be worried about that? Is this a great case for counseling? Genetic counseling comes in. I think you did such a great job of emphasizing that counselor part of your title, which I
Yeah.
think oftentimes gets missed,
Yeah.
um,
Yeah.
because the
Absolutely.
genetic part stands out so strong. But do
Yeah.
you mind talking a little bit more about that?
Yeah, absolutely. First of all, I can imagine that that's a very stressful situation to feel like now all of a sudden is this running in the family now that a second person has been diagnosed. And so I would say for the specifics, see a genetic counselor because they'll help give you your specific risk information based on the full family picture. But yes, technically, if two family members have developed ALS, even if no genetic cause has been found, we would still consider other family members to be at increased risk based on the family history. And what exactly that is would depend on, how closely related were those other family members? Is it like a third cousin versus is this like a parent-child relationship? And so, regardless of whether or not we can find a genetic answer and use that to inform, counseling, certainly people might just need someone to talk to that understands how stressful that is to go through that and to help them through that experience and help them get resources for what it may feel like to live with this potential risk and the uncertainty that comes without being able to have that yes or no answer of offering predictive testing. So I think absolutely genetic counseling would be appropriate in that scenario.
Oh, great. And then building off of that, there was also another question that came in about just genetic counselors. Like, are there more specific genetic counselors that somebody should be seeking out that have a background in ALS or other neurodegenerative disorders? Can you see any genetic counselor?
Good question. So many genetic counselors do sort of subspecialize. We all have training in all areas of genetics. So technically, any genetic counselor should be able to, provide this information and counseling. But certainly, the same way if you had, a heart problem, you'd probably go see a cardiologist instead of talking to your PCP. With genetics, it can be better if you can find someone who's got experience or expertise in ALS or neurogenetics in general. And so on that Find a Genetic Counselor tool, you can filter by neuro. And also, if you ask your neurologist for a referral, they hopefully would be able to connect you with someone that they may know who's got experience with ALS or related conditions. And the other sort of thing I'll plug is that if you go to a telehealth company, sometimes they have genetic counselors that specialize in like neurology, for example. So there's several different ways to make sure you land with someone who is a good fit.
And then there was another question kind of building off of that, specific to our us being in Chicago and Northwestern Medical Group.
Mm-hmm.
Yes, Northwestern does have an ALS specific genetic counselor. I believe she does all of the neurodegenerative conditions. So as Laynie had mentioned, Parkinson's, any sort of dementia umbrella, whether it's just a regular dementia or specifically Alzheimer's disease. And her name is Lisa Kinsley. And for that specific person, I can email you. Her contact info should be on Northwestern's website. It may be on our website, but I will email you directly her information. Um, and then there was another question. I'm not sure if you might be the best person, but Tim, I can email you directly. They were just curious of where they could find specific studies that are looking at specific genes, like for example, SOD1 or C9orf.
Yeah.
And I'm not sure if you would if you would know that offhand, but I can
Yeah.
get that
Yeah.
information for you.
So the clinicaltrials.gov link at the bottom of the screen right now is the best place to go. So you can search by ALS as the condition, and then where it asks for other, you can plug in the gene name. Clinicaltrials.gov can be a bit clunky to look through, and so you can always ask your neurologist or genetic counselor to also help with that. There's also some good resources available through IMALS, which is also linked here, where they have a sort of list of trials and observational studies that are ongoing.
Mm-hmm. And Tim, who asked that, I believe if you're in the Chicagoland area, on our website is Emma Schmidt's contact information. She would be the person to reach out to if you're in the Chicagoland area who works at Northwestern. So she's the research coordinator for Northwestern. But like I said, I can email that to you out. I think we've covered a lot, and thank you for also, somebody had a question just about the value of genetic screenings in research, but I think you did a lovely job kind of emphasizing how that really is really beneficial for research, and especially research we see coming up in the pipeline for more of that targeted gene therapies.
Yes, exactly. The more we can learn about people with ALS, especially people who have been found to have genetic causes and their asymptomatic family members, the more it'll help us with this drug development over time, and also learning more about what to expect for the future. Yeah.
Fantastic. So what I am trying to do now is get back to my presentation mode, which you still can't see. Now you can. So everyone, I just want to thank you for joining. Where is my mouse? And let me swap that out again. Just a big thank you again for everybody who joined today. Laynie, thank you so much for your time and expertise. I really appreciate it. Again, we look forward to seeing you in February. We have a really special talk coming up where Ann Litsky, who is one of our support group facilitators, will be talking about exploring religion and spirituality within the ALS journey. So we look forward to seeing you there. And then again, once we are done here, you'll be sent a survey. Please feel free to fill that out. It really helps us determine kind of what our curriculum looks like, what educational materials you all are looking for, and it helps us just provide better information in the space. So you make us better. Thank you so much. And feel free to interact with us. We are on Facebook, Instagram, Twitter /X, LinkedIn, and we have a YouTube channel. So we look forward for you interacting with us, and we will see you in February, everyone. Thank you so much. Bye.